Good morning, guys. Today we have very interesting topic because everybody will see it in your life. Somebody will afraid this situation. Somebody will be pray doctors and know how they can stop the bleeding. And one interesting moment, I have many my college with who I study in the university, and after uh, ending or finishing of the education, somebody of them cannot stop the bleeding and always please do it the surgery. But this is wrong tactic. How you understand that when you finished the bleeding, if you finish the bleeding faster, it will be better for your patient. Okay, what we need remembering when we talk about the bleeding, it is a hemorrhagic shock. It is a fast decrease in blood circulation volume and can cause development of hemorrhagic shock. Yeah, if it's when we talk about the bleeding. How you see, if we have loss of intravascular volume, yeah, because we have the bleeding, we will have the less or decrease of the venous return, and it lead to less of cardiac output. Yeah, and all of this lead to the shock. The second why we afraid hemorrhages, it is the acute anemia because we have the loss of erythrocytes. And how you know the erythrocytes, it's very important guys for our organism, and they give too much oxygen for us. The third one, it is an accumulation of blood in skull or pericardium, and it is dangerous for life because of squeezing. It will happen the squeezing of life important organs, for example, brain and heart. The fourth, what is dangerous for us when we talk about the hemorrhage, it is a development of permanent complications like peritonitis, empyema in case of accumulation of blood in abdominal or pleural cavity. And the fifth, it is the injury of the major cervical or thoracic vessels, because it can lead to the air embolism. Occurs as a result of air entering the neck veins through the laceration, which subsequently reaches, reaches the right cardiac chambers to finally obstruct the branches of the pulmonary artery. Of course, for us, it's important from you to know classification of hemorrhages. And we have five classification: the mechanism classification, cause classification, type of injury vessel, time of bleeding, and time of beginning, and place of hemorrhage. When we talk about the mechanism, we understand that we can have mechanical and neurotrophic mm, bleeding. If we talk about the mechanical, it is disruption or erosion of a vessel. If we talk about the neurotrophic, it is increased permeability of vessels as a result of vascular wall pathology, which can be secondary to viral disease. If we repeat the mechanical when we have the trauma, the neurotrophic, it's when we have the pathologous disease, yes, what lead to the problem with wall vessel. Classification on cause. We have the hemorrhage per Rexin as a result of mechanical damage to the vessel. Hemorrhage per diabrozine result from erosion of blood vessels by a tumor, in tissue necrosis, and in infections. And we can have hemorrhage per diapedazine due to a defect in the permeability of the vascular walls. Yeah, and if we will talk about the examples, the hemorrhage per Rexin, it is, of course, the damage, the trauma. If we will talk about the hemorrhage per diabrozine, it is a situation when we have, for example, the purulent disease, yeah, like abscess, and when abscess will delete the tissue, he will delete the he will not delete damage. He will damage not just the fat, yeah? He will damage the nerves, he will damage the arteries, and this situation we call a perdiabrosing. And diapedazing, it's the situation like when we have the disease with hemophilus problems. Or you can thinking about the neurotrophic disease. For example, diabetes mellitus with neurotrophic problem. Yeah, it is a good example. One type of injured vessel: arterial, venous, capillary, parenchyma. Not high to differ it. There you see that if we have the arterial, we have the bright red. This is not really right. When we will have the arterial bleeding, more often we will have the pulsation of the vessel. When we talk about the venous bleeding, more often we will talk about without pulsation. Capillary, it's hard to understand capillary it is or the vessel, but when we talk about the capillary, you can thinking about the situation when you damage just an upper layer of the skin and you see there a small wound with small bleeding, what will finish in a few seconds, few minutes maybe. And this is a capillary. And when we talk about the parenchymal, of course, it is a parenchymatous organs will damaged. On time of beginning: primary and secondary. Primary, like a result from an injury to a vessel, and secondary, we delay to early and late. Early occurs if a clot breaks away from the vessel because of a rise in blood pressure, and late is due to clot dissolution, leukodystenic infection, or erosion of the vascular wall. On place of hemorrhage. When we talk about this one, we talk about the external bleeding and internal, and it is not so easy to understand. Of course, we will talk about this one some uh, next slides. Science. When we talk about the science, of course, we have the general science and the local science. What about the general science? It is extreme pallor of skin and visible mucous membranes, blurred visions, dizziness, thirst, drowsiness, fainting, tachycardia, and hypotension. It is the general. And local science: when a major vessel is damaged, the affected limb becomes ischemic, pale and cold on touch, its sensation is impaired, and distal pulses are not palpable. No, and of course you see the vessel. Yes, what do a or yeah. This is different just when we talk about the artery and the blood and the venous. Internal bleeding. There we have the general and local science too, but local science vary with the location of the bleeding vessel. Internal bleeding can be into a hollow organ, discharge via a natural opening outside. Is also difficult to determine. Color and time of blood is great importance. We will talk about this. Foamy bright red blood in bleeding from the lung. Ground coffee-like vomitis in gastric or duodenal hemorrhage. Melena or black stools in bleeding from the upper gastrointestinal tract. Bright red blood coming from the rectum in bleeding from the sigmoid or rectum. Hematuria in bleeding from the kidney or urinary tract. Special diagnostic procedures: placing in a probe into the stomach, digital per-rectum examination, endoscopic methods, bronchoscopy in disease of the lung, esophagogastroduodenal, rectosigmoidal, and colonoscopy for gastrointestinal hemorrhage, cystoscopy for disease of the urinary tract, ultrasound, X-ray, radioisotope method. Radioisotope method. It is a radioactive isotope injected intravenously accumulated together with the hemorrhage blood. In a tissue cavity or hollow organs, it will come in. An increase in radioactivity in the area damaged is found during radiometry. Internal bleeding in the body cavity, hemiperitoneum, hemothorax, hemipericardium, intracranial hemorrhage, and hemarthrosis. When we talk about hemiperitoneum, it is accumulation of blood in the abdominal cavity, associated with lacerations and blunt injuries to the parenchymal organs, the liver, spleen, or mesenteric vessels, rupture of an ectopic pregnancy or an ovarian cyst, loosening of the ligature placed on a bleeding vessel, local cells, restricted abdominal breathing, abdominal pain, slight rigidity of the abdominal wall, mild peritoneal symptom like a Bloomberg symptom, dual tympanitic sound over the areas of blood accumulation when about 100 milliliters are accumulated. Hemothorax is accumulation of blood in the pleural cavity, results from injuries to the chest and lung, surgical manipulations, disease of the lung and pleura, like tuberculosis or tumors. Internal bleeding, accumulation of blood with the tissues, we call the hematoma. Most dangerous hematomas commonly result from the damage to the major blood vessels. If there are connection to an arterial lumen, like you see in the picture, we will call it pulsation hematoma or false aneurysm. The pulsation over the swelling is synchronous with the pulse rhythm, the presence of a blowing systolic murmur on auscultation. Sometimes you need to auscultate the bruise. Acute hemorrhage shock. Development of shock depends on the intensity, duration of bleeding, and the volume of blood loss. A fast decrease, 30% blood circulation volume can cause acute anemia, hypoxia of the brain that can be fatal. When bleeding persists for a long period but in smaller amounts, there are only few circulatory changes and the patient can live with as low as 20 grams per liter of hemoglobin. Maintains of hemodynamics. First of all, reduction in blood circulation volume. Then, decrease in venous pressure and the heart ejection force. Stimulating adrenal secretion of catecholamines. Vascular spasm and a reduction in vascular volume. And maintain of hemodynamics in a safe state. For degrees of blood loss, mild, a reduction in blood circulation volume of 10–12% or 500–700 milliliters of blood. Moderate, a reduction in blood circulation volume of 50–20% or 1,000–1,400 milliliters of blood. Severe, a reduction in blood circulation volume of 20–30% or 100 1,500 and or 200 milliliters of blood. And a massive, when we talk about a reduction in blood circulation volume of more than 30% or more than 200 milliliters of blood. Determination of blood loss volume, 57% of mass of balls and napkins which were used at the operation. On blood specific gravity, 37 per 165 minus blood specific gravity. On blood viscosity and hematocritus. For men, 100 for a volume blood viscosity and hematocrit less than 600, 6,700, and for moon another. Laboratory investigation. Checking for levels of the red blood cells, hemoglobin, and hematocrit should be done on admission and repeated afterward. In severe bleeding, the results of those investigations may not serve as objective indicators of the degree of hemorrhage in the first few hours. Science auto hemodilution occurs with time, reaching its maximum within 1–2 days. Methods of hemostasis. We have two types, temporary and definitive. When we talk about temporary, it's for example digital pressure on artery. There you see how we can to do the pressure on the pubis femoral artery and in the pubis subclavian artery to first rib, subclavian artery to first rib. There you see the arterial radius on the shoulder. There you see a carotid artery, and there you see another type. It is a flexion of the limb in joint. How you see we can to do the bandage, and it lead to a decrease of bleeding. There you see another type of temporary tamponade. It is applied the clamp on the bleeding vessel, but more often it happened in the surgery in operations. And now about the definitive mechanical. Ligating the bleeding vessel inside the wound, suture of wound with bleeding vessel, ligation of the vessel along its length, it's indicated when its ends cannot be identified the wound. This is also the cause in secondary bleeding when the road vessel is located in the inflammatory mass. Vascular sutures. A large tissue defects resulting from the injury can be covered with a patch from biological materials. An autovein is most commonly used. Allotransplantation of arteries and veins, xenotransplants, and artificial embolism of vessels. The most specific and most new type of definitive type of bleeding. Physical, surgical diathermy, laser coagulation, ultrasound coagulation, airgun coagulation, and cryosurgery. Definitive chemical and biological. It is a fibrinogen, prothrombin complex, anti-hemophilic globulin, cryoprecipitate, inhibitors of fibrinolysis, diazinon, vicasol, topical hemostatics, like a thrombin, is effective in capillary and parenchymal bleeding. Yeah, and you know, when we talk about the transfusiology, we talk about the platelets. Yeah, and you of course can use this one to the chemical type of bleeding. That's all what I want to tell you in this case of bleeding. It's not a hard topic, I think. All what you need to remember in this one. In the practice, we will talking some more about this bleeding. See you on the practice.